When we talk about fighting cancer, so much of the focus is on the big guns, the treatments designed to just wipe out the disease. But for the patients going through it, the fight is just as much against the treatment itself and those brutal, debilitating side effects. Today, we're going to look at a really interesting study that might have found a new way to help with one of the absolute worst parts of that whole journey.
It's a pretty wild question, isn't it? The idea that a totally natural compound, something from a fungus, of all things, could bring relief where other treatments just aren't cutting it. So yeah, let's jump right into the science and see what they found. Okay, so before we get to the mushroom, we really have to understand the problem these researchers were up against. And it's a big one. It's a condition that can literally stop a patient's treatment in its tracks and just tanks their quality of life.
And the scale of this problem is, well, it's huge. This quote from the paper says it all. For patients with head and neck cancer, this isn't some fringe complication. We're talking about more than 2/3 of them. That's the harsh reality for the majority of these patients, which makes finding a solution incredibly urgent.
The condition is called oral mucositis, or OM for short. And we are not just talking about a couple of mouth sores. Imagine your mouth and throat being so inflamed and ulcerated that eating, drinking, even talking is just agony. It gets so bad that some patients actually have to pause or stop their cancer treatments. So you can see why finding a way to manage this is it's absolutely critical.
So with a problem this severe, researchers started looking for answers in a pretty unexpected place, the world of fungi. And they didn't just pick any random mushroom. They zeroed in on this one specific protein, called GMI, that comes from the Ganoderma microsporum mushroom. It's what's known as an immunomodulatory protein. That's just a sciencey way of saying it can help calm down the body's immune response. And what's really cool is that earlier studies in mice had already hinted that this protein could help protect the mouth and gut from chemo damage.
And this wasn't just some lab experiment. The researchers had a super practical goal. They took this GMI protein, which you can actually get in a commercial supplement called Reishi S, and they set up a trial to see if it could make a real, measurable difference for people. So, you've got the idea, you've got the supplement. How do you actually design a test to see if it works? Because, in any kind of study like this, the setup is everything.
So at first, the plan was pretty straightforward. Your standard clinical trial. They got 83 patients, and we're going to split them into two groups. One group gets the mushroom supplement plus the usual standard care, and the other group, the control group, just gets the standard care. Simple, right? But then, something really unexpected happened. Something that completely changed the study and honestly tells you everything you need to know about how bad this condition is. This is a quote word for word from the paper, and it is just stunning. Every single one of the 16 patients in the control group, the ones just getting standard care, they all dropped out. Just think about that for a second. The standard treatment was so useless, and they were in so much pain that they all just withdrew, figuring there was zero hope of it helping them. So this just blew up their original plan. The researchers had to pivot. The study became what's called a single-arm trial. They couldn't compare the supplement to anything anymore. All they could do was watch and see what happened to these 67 patients who were actually taking the supplement. Okay, so after that pretty dramatic twist, all eyes were on that one remaining group. Let's dig into the data and see what they found. This is it, the million-dollar question, right? Did this mushroom protein actually do anything to help with their awful oral mucositis? And the answer looks like a pretty clear yes. Let's walk through this. On the left, in chart A, you're looking at how doctors grade the severity of the condition. On day 1, you can see the average score is up around a 2. Now look what happens by day 15, after just 2 weeks. The average score drops way down to just over a 1. That is a fast and really significant improvement. Now, this middle chart here, this one is even more striking. It shows you the percentage of patients at each level of severity. On day 1, see those orange and red bars? Those are the worst of the worst cases, grades 3 and 4. Now, just slide your eyes over to day 15. They're gone. Poof! Not one single patient had severe OM after that 2-week period.
The clinical scores are one thing, but what does this actually mean for the patient? How did they feel? Did this translate into a better life? Because at the end of the day, that's what it's all about.
So the results here were a little mixed, but still really promising. It didn't seem to make a big statistical difference in things like pain or swallowing. But look at where it did. Patients reported having way less trouble with social contact, and they lost less weight. I mean, for someone going through chemotherapy, being able to stay social and not lose a ton of weight, those are gigantic wins. All right, so when we put this all together, we've got a story that feels incredibly hopeful, but it's science, so it also comes with a few very important footnotes. The main takeaway is pretty clear. In this study, for these patients, the Reishi Immune S supplement seemed to work, and it worked fast. It seriously dialed back the severity of this miserable side effect. But, and this is a really big but, we have to be honest about the study's limitations. Not having that control group is the big one. It means we can't be 100% positive something else wasn't at play. It was also a pretty small number of patients, and they were only followed for 2 weeks. Now, that doesn't mean the results are wrong. It just means we definitely need more research. So, no, this one single study doesn't give us the final answer, not even close. But it does open up a really fascinating door. And it leaves you with this incredible thought. Could an answer to one of modern medicine's toughest problems be hiding in the natural world, in something as simple as a mushroom?